Hi, my name is Katie. I was part of group 2, so I had case study 2, which was on Mycobacterium tuberculosis. So the prompt for case study 2 was a patient arrives at the hospital with a cough that has lasted for 2 weeks, a fever, chest pains, fatigue, and blood in their sputum. A TB test was performed. After the gram acid fast and endospore stains were performed, the results were seen below, which will be on the next slide. So these are the results of the tests. You can see in the first image the gram stain results were gram stain positive because the bacteria appeared purple. In the second, the acid fast stain results, they were also positive. The bacteria appeared pink. And in the last one, the endospore stain, there are no purple spores in the image, so it was endospore negative. What does all this mean? So all of this together means that the bacteria is Mycobacterium tuberculosis, which causes tuberculosis in humans. Mycobacterium tuberculosis, a little bit about the bacteria itself. It is a fairly large rod-shaped bacterium. It is an obligate aerobe, which you could probably assume as it affects the respiratory tract. And it is a mesophile, meaning it does best around body temperature. How is it transmitted? Now, the problem with tuberculosis, it is very contagious. It is highly communicable. Transfer is via inhalation through the respiratory tract, so coughing, sneezing, breathing, a lot like the COVID crisis we've been having lately. Tuberculosis is a huge problem for that as well. It can also be passed on clothes, on hair, left on surfaces, especially blankets, sheets, curtains, things like that. The bacteria can stay on there and be transmitted. It does mainly affect the lungs, but it can affect other parts of the body as well as other organs and other organ systems as well, depending on the strain and the severity of the tuberculosis. Now, what are the symptoms? First and foremost, probably most obvious, cough. Cough would be long-lasting and usually includes coughing up blood, but could also include coughing up mucus. Chest pain goes along with the cough, fever, sweats, chills, fatigue, weight loss, and in severe cases, loss of muscle mass and muscle tone as well. Prevention and testing. Now, while a vaccine does exist for tuberculosis, it is not given in most countries. It is really prevalent in developing countries where childhood tuberculosis is a problem, but in most first world countries such as the United States, we don't normally give out the vaccine preventatively. Instead, in countries like the United States, we do tuberculosis blood tests, just to test children, especially to see if they have tuberculosis. The problem with these blood tests is, of course, they aren't preventative, and they aren't usually that sensitive, so they can't tell us if the TB is latent or active. Now, the treatments and mortality rate, the only way to treat tuberculosis is through antibiotics. Rifampin is a common treatment, as well as isoniazid and ethambutol. However, there are unfortunately strains of tuberculosis that have evolved to be antibiotic resistant, meaning there's little to no treatment that can be done for these. However, as most strains are treatable and modern medicine has come a long way, the mortality rate in the modern day is about 4 to 12%, meaning 88 to 96% of people who get tuberculosis are cured and can continue to live. Now, why is this clinically relevant? Again, it's highly communicable, it is very dangerous, and it can be passed person to person so easily. It is extremely fatal without treatment, and mortality rate rises dramatically from 4 to 12% to 53 to 86% without treatment. Now, something a little bit interesting that is also clinically relevant is here in Peoria, there were two centers for treatment for tuberculosis There was the Peoria Municipal Tuberculosis Sanitarium, as well as the Peoria State Hospital, which had the Pollock Tuberculosis Hospital within it. These are some of the sources I used for this presentation. At this point, I would normally ask if there are any questions, which doesn't super work in this format, but if anyone does have any questions, please feel free to post them below. Thank you.